right, everyone, let's talk about a topic that is guaranteed to show up on your exams, candidiasis. If you're prepping for your MBBS, you know mycology can be a headache. So today, we're going to cut through the noise and give you a high-yield, exam-ready guide to absolutely nail this topic. Let's jump right in. So let's start with a quick question to get us warmed up. What do you think is the #1 most common fungal disease that affects people? You got it, it's candidiasis. It's incredibly common, and that is exactly why your professors and examiners love to ask about it. So here's our game plan for today. First, we'll define what candidiasis actually is. Then we'll get into how it attacks the body. After that, we'll cover how to spot it, how to diagnose it in the lab, and of course, how to treat it. And we'll wrap it all up with some quick revision points to lock it all in. Okay, first things first. What exactly is candidiasis? Let's lock in a solid exam-proof definition. So in simple terms, candidiasis is a fungal infection caused by a bug called Candida. Now, for your exams, there are 2 phrases you absolutely have to remember. 1, it's a yeast-like fungus. And 2, it produces pseudohyphae. That's its signature move. This infection can be pretty minor, just on the skin, or it can be super serious, affecting internal organs. Now, Candida isn't just one thing. It's a whole family of species. The main villain, the one you'll see 9 times out of 10, is Candida albicans. But you've got to know about the others too, and pay special attention to Candida auris. This one's a huge deal right now. It's an emerging superbug that's resistant to a ton of drugs, which makes it a massive clinical challenge and a really hot topic for exams. So you might be wondering, Candida is actually a normal part of our body's flora, right? So how does it suddenly turn bad? Well, that's what this next section is all about, the risk factors that give it an opening to attack. And here's a super simple way to remember the risk factors. Just think A, B, C, D. It's perfect for your short answer questions. A is for age. We're talking the very young and the very old, whose immune systems just aren't as strong. B is for broad-spectrum antibiotics. They're great at killing bad bacteria, but they also wipe out the good guys, which lets Candida overgrow. C is for corticosteroids, which suppress the immune system. And finally, D is for decreased immunity or diabetes. This covers things like HIV, cancer, or just poorly controlled blood sugar. A, B, C, D. Easy. Remember how we said Candida produces pseudohyphae? This is a really important point. It's one of its main weapons. You have to be able to tell them apart from the true hyphae you see in molds. So, look at the table. The key difference is at the septa, or the joints. Pseudohyphae are pinched in, they're constricted, they kind of look like a string of sausages. True hyphae aren't. This is a classic spot the difference question in your practical exams. Okay, so we know what it is and how it gets a foothold, but what does a patient with candidiasis actually look like? Let's run through the clinical features. The infections can range from pretty mild to really life-threatening. To help you organize this in your head, here's another easy mnemonic, IMC. I is for invasive disease. This is the really bad stuff, like septicemia or meningitis. M is for mucosal infections, like oral thrush in the mouth. And C is for cutaneous, which is on the skin and nails. This little framework is perfect for structuring your answers. Right. So you see a patient and you think, this looks like candidiasis. How do you actually prove it? This is where the lab comes in, and this stuff is bread and butter for your practicals and vivas, so listen up. The process is really logical. You start by collecting the right sample, a swab for thrush, a blood sample if you suspect septicemia. Then you take a quick look under the microscope for immediate clues. After that, you culture it on a special agar to grow the fungus. And finally, once it's grown, you do tests to figure out exactly which species of Candida you're dealing with. So, what are you looking for on that microscope slide? After a gram stain, you're looking for these classic gram-positive oval-shaped budding yeast cells. And you'll often see those pseudohyphae we talked about. But here is a massive 5-star exam tip. Candida glabrata, which is pretty common, is the exception to the rule. It does not make pseudohyphae. That is a classic MCQ trap, so don't fall for it. Okay, so you've grown Candida in the lab. How do you know if it's the common troublemaker, C. albicans? Well, there are 3 key tests. First, the germ tube test. It's the most specific one. C. albicans forms these little tube-like things in serum. Second, on a special type of agar, it produces these really thick-walled spores called chlamydospores. And third, it can grow at a toasty 45 degrees Celsius, which helps you tell it apart from its close cousin C. dubliniensis. Now, for those really serious invasive infections, we have a handy blood test called the beta-D-glucan assay. Think of it as a general smoke alarm for fungi. It detects a component of the fungal cell wall. It's really sensitive, but it's not specific. It just tells you some fungus is there. But if it's positive in a high-risk patient, that's a huge red flag. Now, just as important as knowing when that alarm goes off is knowing when it doesn't. You have to know the exceptions. For this, I want you to burn this mnemonic into your brain. ZBC. The beta-D-glucan assay will be negative in zygomycosis, blastomycosis, and cryptococcosis. I guarantee you this will come up on an exam. ZBC. Okay, we found the fungus, we identified it. Now what are we going to do about it? Let's talk about treatment. Treatment really depends on where the infection is and how bad it is. For something simple like a skin rash or oral thrush, a topical azole cream will do the trick. If it's a bit more serious, like in the esophagus, you'll step it up to an oral pill like fluconazole. But if it's a life-threatening systemic infection, you bring out the big guns, IV drugs like liposomal amphotericin B. This table is basically your treatment cheat sheet. But here's the catch. Treatment isn't always so simple. Remember why we said identifying the species is so important? This is why. C. glabrata and C. cruzi are naturally resistant to fluconazole, one of our most common drugs. And as we mentioned, C. auris can be resistant to basically everything, which makes it a total nightmare to treat. Phew, we've covered a ton of information. So now for the most crucial part, especially for that last-minute cram session before your exam. Let's do a rapid-fire revision to make sure these key facts are stuck in your head. Okay, let's fly through this. Most common species, C. albicans. What are the risk factors? Think ABCD. What do you see on the microscope? Gram-positive yeast with pseudohyphae, unless it's C. glabrata. What's the specific test for albicans? The germ tube test. When is that beta-D-glucan assay negative? ZBC. And which are the big bad resistant species? Glabrata, cruzi, and that scary one, auris. Got it? Good. And there you have it, your complete exam-ready guide to candidiasis. So I'll leave you with this final thought to chew on. With these multi-drug-resistant species like C. auris on the rise, the big challenge isn't just about diagnosing the infection anymore. It's about finding a drug that can actually treat it. It makes you wonder, what is the future of antifungal therapy going to look like? Thanks for joining me, and good luck with your studies.